Setting Boundaries with Confidence, a Rational Emotive Behavior Therapy Guide. Emphasizing boundaries is a common practice in contemporary psychotherapy and has both pros and cons. Understanding these aspects can help therapists navigate the complexities of therapeutic relationships. In this video, learn how the Rational Emotive Behavioral Therapy model can help clients develop healthy boundaries that avoid the negative aspects of boundary creation. The pros of emphasizing boundaries in psychotherapy. 1. Establishing safety. Pro. Clear boundaries create a safe and predictable therapeutic environment, fostering a sense of security for clients. 2. Professional ethics. Pro. Strong boundaries are essential for maintaining ethical standards and ensuring that therapists adhere to professional guidelines. 3. Role clarification. Pro. Boundaries help delineate the roles of therapist and client, preventing role confusion and maintaining the therapeutic alliance. 4. Preventing dependency. Pro. Healthy boundaries prevent unhealthy dependency, encouraging clients to develop autonomy and self-reliance. 5. Modeling healthy relationships. Pro. Therapists modeling and maintaining boundaries can serve as a positive example for clients in understanding and establishing healthy relationships. Cons of emphasizing boundaries in psychotherapy. 1. Rigidity and distance. Con. Overemphasis on boundaries may lead to rigidity and emotional distance, hindering the development of a genuine therapeutic relationship. 2. Cultural sensitivity. Con. Strict adherence to boundaries may clash with cultural norms and expectations, potentially alienating clients from certain cultural backgrounds. 3. Limiting authenticity. Con. Excessive focus on boundaries might limit the therapist's authenticity, making it challenging to engage in more personal and emotionally resonant interactions. 4. Fear of imposing. Con. Therapists overly concerned with maintaining boundaries might fear imposing their values, potentially hindering exploration of certain topics critical to the therapeutic process. Addressing the cons without rejecting the pros. 1. Flexibility within boundaries. Balancing act. Therapists can maintain a balance between clear boundaries and flexibility. Recognize that therapeutic relationships are dynamic, and flexibility within appropriate limits can enhance the therapeutic process. 2. Cultural competence. Cultural sensitivity training. Therapists should undergo cultural sensitivity training to navigate diverse cultural expectations. Discuss and negotiate boundaries with clients, considering cultural nuances and individual preferences. 3. Transparency and open communication. Promoting authenticity. Therapists can be transparent about their professional role while still being authentic and emotionally present. Open communication about the therapeutic process can address concerns related to emotional distance. 4. Emphasis on empowerment. Empowering clients, rather than merely preventing dependency. Therapists can emphasize empowering clients to recognize and meet their own needs, fostering a sense of self-efficacy. 5. Regular review of boundaries. Ongoing assessment. Therapists can regularly review and assess the appropriateness of established boundaries, considering the evolving needs and dynamics of the therapeutic relationship. 6. Supervision and continuing education. Professional development. Therapists should engage in ongoing supervision and continuing education to stay informed about evolving therapeutic practices and ethical considerations. 7. Seeking client feedback. Client input. Actively seek and value client feedback on the therapeutic process, including discussions about boundaries. This collaborative approach can enhance the therapeutic alliance. 8. Cultivating emotional intelligence. Emotional awareness. Therapists can cultivate emotional intelligence to navigate the balance between empathy and professional distance, ensuring that emotional engagement is supportive rather than detrimental. Striking a balance between emphasizing boundaries and addressing potential drawbacks involves flexibility, cultural competence, transparency, ongoing assessment, and a commitment to both professional ethics and the therapeutic relationship's authentic and empowering aspects. Therapists who navigate these complexities with sensitivity and responsiveness can create a therapeutic space that is both safe and conducive to meaningful client growth. Rational Emotive Behavior Therapy, developed by Albert Ellis, is a cognitive behavioral approach that can be effective in helping clients establish healthy boundaries. REBT focuses on identifying and challenging irrational beliefs that contribute to emotional distress and maladaptive behavior. Here's how REBT can be applied to help clients embrace the pros and avoid the cons of boundaries. 1. Identifying irrational beliefs. Pro. REBT encourages clients to identify irrational beliefs that may contribute to difficulties in setting and maintaining boundaries. This could include beliefs about needing everyone's approval or fearing rejection if boundaries are established. Con. Some irrational beliefs may contribute to excessive rigidity or fear of emotional closeness. 2. Challenging unhealthy thoughts. Pro. REBT involves challenging and disputing irrational thoughts and beliefs. Clients can be guided to question beliefs that hinder the establishment of healthy boundaries, such as the belief that setting boundaries is selfish. Con. Clients may hold irrational beliefs that promote rigid boundaries, preventing authentic connection. 3. Cognitive restructuring. Pro. REBT helps clients restructure their thinking patterns, promoting more realistic and rational beliefs about boundaries. This may involve reframing the idea that setting boundaries is a sign of weakness. Con. Clients may resist changing beliefs that contribute to emotional distance. 4. Behavioral techniques. Pro. REBT incorporates behavioral techniques to help clients practice setting and maintaining healthy boundaries in real-life situations. This may involve assertiveness training and gradual exposure to boundary-setting scenarios. Con. Clients may initially feel uncomfortable or anxious when practicing new behaviors. 5. Teaching emotional regulation. Pro. REBT emphasizes emotional regulation skills, helping clients manage anxiety, fear, or guilt associated with setting boundaries. This is crucial for avoiding emotional distance or excessive rigidity. Con. Some clients may struggle with emotional regulation, leading to challenges in navigating boundary-setting situations. 6. Promoting self-responsibility. Pro. REBT encourages clients to take responsibility for their thoughts, feelings, and behaviors. This includes taking responsibility for setting and communicating their boundaries effectively. Con. Clients may resist taking responsibility for the impact of their boundaries on others. 7. Examining consequences. Pro. REBT involves exploring the consequences of holding rigid or overly permeable boundaries. Clients can evaluate the impact on their relationships, emotional well-being, and overall life satisfaction. Con. Some clients may fear negative consequences and resist making changes. 8. Encouraging flexibility. Pro. REBT promotes cognitive flexibility, allowing clients to adapt their beliefs and behaviors based on the context. This can help in avoiding overly rigid or permeable boundaries. Con. Clients may struggle with the uncertainty that comes with flexible boundary setting. 9. Fostering a rational emotive worldview. Pro. REBT encourages a rational emotive worldview, helping clients view boundaries from a more rational and balanced perspective. This can lead to healthier interpersonal dynamics. Con. Clients may hold on to deeply ingrained irrational beliefs that resist change. 10. Integration of philosophical aspects. Pro. REBT incorporates philosophical aspects that align with the pros of healthy boundaries, emphasizing self-respect, autonomy, and personal responsibility. Con. Some clients may struggle with philosophical aspects that challenge their existing worldview. 11. Ongoing evaluation and adaptation. Pro. REBT encourages ongoing self-reflection and evaluation, allowing clients to adapt their beliefs and behaviors related to boundaries based on their evolving understanding and experiences. Con. Resistance to ongoing evaluation may hinder progress. In summary, REBT can be a valuable therapeutic approach for helping clients establish healthy boundaries by addressing irrational beliefs, promoting cognitive and behavioral change, and fostering emotional regulation. Therapists utilizing REBT should tailor interventions to address specific challenges related to boundaries, considering individual client needs and cultural factors. The collaborative exploration of beliefs and the gradual implementation of behavioral strategies can contribute to a more adaptive approach to boundary setting.